Good evening, I'm Ian Hannamansing. Tonight, a troubling winter forecast, COVID surging back. The holidays could push Canadian cases to hit record highs. Then there's Omicron.
I'm just urging extreme vigilance and caution.
And the warning to rethink your sunny vacation. But there is some good news for holiday plans closer to home. Ottawa puts Washington on notice over electric vehicles.
Canada is prepared to stand up for our national interest.
Unprecedented damage on the most important highway connecting Vancouver with the rest of Canada.
This is a massive job.
How long it could take to repair.
Tonight.
Bringing a classic into the 21st century.
We all had to wear ultra dark makeup because we were Puerto Rican.
How the new West Side Story is celebrating diversity. This is The National. The Public Health Agency of Canada has warned that winter could set the stage for a COVID resurgence. Those warnings are backed by modeling which shows the potential that the pandemic could spread faster than ever before. If we stay on the current track, officials project by the end of January, Canada could have somewhere around 7,000 cases a day. That's high, but not unprecedented in this pandemic. But if transmission rates increase during the holidays, the daily case total could jump to 12,000 within just a few weeks. And even if we stay vigilant on transmission, Omicron could push new cases off the charts to more than 26,000 a day. But despite that, public health officials say the holidays can be celebrated with precautions. Here's Christine Birak on why this pandemic Christmas won't be like the last one.
I'll see if I can see anything locked up.
Party planner Dawn Eisenberg is used to rolling with the punches, but
I think they've stopped thinking that they're going to stop.
And here comes the next one.
I am concerned about the rise in Omicron across Ontario.
The province's chief medical officer says more and more infected samples are now testing positive for the variant.
So we've gone from 10%, it may be up to 20% in the coming days, and then become a dominant strain, as in complete strain replacement of Delta by the beginning of January.
In response, Ontario joined several other provinces announcing those 18 and over will soon be eligible to book a booster shot. Ontarians will also need to start showing a QR code as proof of vaccination, and the program is being extended indefinitely.
We have more and better protections going into this holiday and winter season than previously.
Health officials say even with the looming threat of Omicron, a lot has changed for the better.
This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and in intensive care daily.
But health officials emphasize unvaccinated people are 32 times more likely to be hospitalized with COVID-19 than fully vaccinated people. And the latest federal data shows while a large majority of Canadians over 12 are now fully vaccinated, cases are still highest among children under 12, which is likely why officials pointed out with high vaccination among 5 to 11-year-olds and boosters for everyone else, hospital capacity will not be exceeded.
I don't think society has to close. I don't think we have to really suffer or go back to the terror that we had a year ago. I think we know what to do. We just have to do it.
As an event planner, we're always ready for the unexpected.
Which now means smaller gatherings, better masks, and good ventilation. Christine Birak, CBC News, Toronto.
Well, to provide some context and maybe even some comfort on all of this, we bring in Dr. Isaac Bogosh, infectious disease specialist. And Dr. Bogosh, as we've seen, the federal modeling suggests we could see some pretty high daily case counts in January. How concerned should we be?
I think we have to approach this with a healthy degree of caution and with respect. Obviously, there's still a lot of unknowns with this variant, but what we do see is that it is pretty transmissible and that it can cause infections and reinfections in people with prior immunity. Still, it looks like the vaccines are holding up and preventing people from having serious illness. It does look like a third dose is better than 2 doses, so I hope there's a degree of urgency, for lack of a better word, to roll out a third dose strategy from coast to coast.
And beyond that urgency on a third dose, what other things should we be doing to try to get ahead of this variant?
In all fairness, we should be vaccinating with those third doses, but we should also take care and really adhere to the public health recommendations that we've been hearing so much about. better ventilated rooms, high quality masks, integrating rapid tests if they're available. These are the tools that'll keep us safe and keep our community safer.
A lot of people are finding all of this exhausting, Dr. Bogosh. What about for you?
Yeah, I mean, it is exhausting. It's almost 2 years into this pandemic. We all want this to be over. I think we're better prepared for this. At least we have the tools to do it. I just hope we do the right thing and use those tools in a proactive manner so we can stay ahead of this. All
right, Dr. Bogosh, as always, thank you very much.
My pleasure.
The government's efforts to get ahead of Omicron have mainly focused on travel, and Ashley Burke shows that alone will have a dramatic effect on holiday plans.
The travel industry was looking for a resurgence this holiday season. Instead, it's looking grim. Bookings at Mohinder Handa's agency are down 75%.
Everybody's having a second thought, so I don't think there's going to be any travel at all in the next month or so.
The situation abroad is both risky and unstable.
The Minister of Health with a warning some travelers may find hard to hear.
If they think about traveling outside of Canada, Omicron should be a big red part of their radar screen. It should be flashing because things are happening very quickly outside of Canada.
The government says Canadians who travel should expect not just inconvenience coming home, but also shifting rules abroad.
I'll follow the rules. I'll do whatever have to be done.
Julio Domingo says he's prepared to take the risk. He's been warned of a 5-hour wait at Lisbon's airport next week, but says it's worth the wait.
That's one of the last times that I was with him.
He left Portugal almost 2 years ago, just before the first lockdown. He's planning to return to celebrate his dad's 92nd birthday on Christmas Eve.
I don't know if I'll be able to give him a hug, because the situation, right? But, at least he's going to see me. I'm going to see him.
And to those staying in Canada, officials are warning to keep gatherings small. Dr. Howard New personally recommending 10 people or less.
I plan to also use ventilation to the max and have the windows open for a certain period of time, maybe on the hour, to also improve the circulation of air. So that's maybe a bit of a warning to my family members who are coming over.
For those insistent on traveling, the health minister says the government is ramping up its COVID testing at airports and with the help of private companies aims to test up to 23,000 international travelers a day. Ashley Burke, CBC News, Ottawa.
Health officials in Toronto are asking close to 20,000 people who attended a recent Raptors game to monitor for symptoms of COVID. Toronto Public Health says the game against Washington, December 5th, was a potential exposure event, and that's defined as an event where a person or people with COVID could have spread the virus to others. The team president, Masai Ujiri, tested positive earlier this week. He was at a gala hosted by his non-profit organization the same day as Toronto's match against Washington.
We've had 55 new cases reported that we know are attributed to the Sinovac outbreaks.
And so now at least 114 cases have been linked to a growing outbreak at St. Francis Xavier University in Nova Scotia. That number is still expected to grow as the province is dealing with a backlog of tests. So far, symptoms have been relatively mild. Cases linked to the outbreak have also been reported in PEI and Ontario. Today saw a major...
Well, the U.S. is battling a COVID surge, mostly fueled by the Delta variant. At least 42 states are reporting an increase in hospitalizations in the past week, and the number of new cases has risen almost 16% across the country. Most of the people suffering serious symptoms are unvaccinated. Nikki Batiste reports from one Pennsylvania medical center under strain.
There's a lot of hoops to jump through just to fight for your life.
Caitlin Lilly's brother, Kyle Whiting, was unvaccinated when he contracted COVID in October. He's been hospitalized ever since.
Do you think that had Kyle been vaccinated, he'd be in a different position today?
I think it would have helped him medically. I think it wouldn't have been as bad, but I couldn't say for sure if it would have prevented all this.
So far, Whiting has spent his 27th birthday on life support and has even missed his wedding. His lungs are no longer functioning, and he now needs a double transplant, an operation that was delayed by a week as he waited for an open bed in a Philadelphia hospital.
He's never going to have the same life he had.
Nationwide, cases are increasing, overwhelming many hospitals. Geisinger Wyoming Valley Medical Center in Wilkes-Barre is operating at about 120% capacity, with nearly a quarter of patients in the COVID unit.
It feels like the outside world has sort of said, well, the pandemic is behind us. And then I go to work and it's very much not.
Emergency room physician Dr. Essie Reed says most of the patients she sees are unvaccinated.
The saddest thing is when they're asking when they can get the vaccine and you're just not sure if they're going to make it to that point.
Dr. Stella Sappho joins us now. She's an internal medicine physician and the founder and CEO of Just Equity for Health. Thanks so much for joining us. So let us talk about, some of what we saw in Nikki Battiste's story there from Pennsylvania. Hospital systems are currently overwhelmed. I think people don't quite understand that when a hospital is overwhelmed with COVID patients, it just doesn't affect the type of treatment the COVID patients are getting. It affects the type of treatment everyone who needs to go to the hospital is getting. Can you talk about the dangers that, this places on the U.S. healthcare system when we have these overwhelmed facilities?
Absolutely. It's a danger both from a resource perspective of having enough beds. An ICU bed is very specialized. It has to have a certain nursing and staff ratio to patient ratio, as do hospital beds as well. And so it's just about having the space to get people onto the floors. This is why you're seeing, emergency room times and waiting times of up to half a day, if not more, for people to just get admitted to the hospital, to the right facilities that they need. And then there's also the reality that we've been in this pandemic going into 2 years. So the people who are providing the care are burned out, they're tired, people are leaving medicine, and so the workforce is also slowly becoming under-resourced as well. So you're dealing with both a resource from an infrastructure perspective being low, as well as individuals that would actually be taking care of you also being lower than we would like to see it at this point with the numbers that we're seeing.
Yeah. Today, what we have is, a plea for rapid tests, a plea to recognize airborne transmission, a plea to stop pretending that bits of plexiglass and a blue gaping surgical mask is enough to protect anyone against anything, because it isn't. We're also pleading for faster access to third shots, and now that we know what Omicron's got in store for us. So these are the things that we've been begging for, and it does seem to be falling on deaf ears. The consequence to that seems to be pretty clear to me. We're going to have a pretty significant escalation. It's not a question of if, but when Omicron really starts to take off here. It could be quite soon. We might be able to hold it off with the travel restrictions we have, but it's going to involve having to close lots of things if we don't move with alacrity. And when I say alacrity, I mean yesterday. We cannot have people sitting in restaurants without masks and without air mitigation. We just can't. That's just going to have to stop. And either restaurants are all going to have to shut down, or they're going to have to start scrubbing their air. You can't do neither. It's going to have to be one or the other. I'm concerned about schools staying open. If we fixed restaurants today, I think schools would stand a better chance. But even then, I'm not entirely optimistic. With the advent of Omicron, I think everything hinges on whether we're willing to acknowledge airborne transmission. I don't see how we're going to keep a lid on things, vaccination aside, because Omicron is quite vaccine evading. I don't know how we're going to be able to keep everything open if we cannot start tackling air quality and start giving better public health guidance around masks and around air mitigation at work and in places like restaurants. There's just a huge amount of inertia because the implications for acknowledging airborne, we also have to say we don't have any safe hospitals. And we don't, but we're not admitting that. And I think it's a lot easier to not admit it than it is to face it. We'd have to say we have been dismissing unsafe work refusals unfairly. We're going to have to go back and revisit all of those. We're going to have to take a responsibility as a government for a lot of mistakes and a lot of under preparation and a lot of remediation and a lot of mitigation. It's going to be expensive. It's going to be embarrassing. It's going to be brutal. That's what a government is facing when it's deciding whether or not to acknowledge airborne transmission.
The Prime Minister facing one of the most testing weeks of his premiership so far, and there were more challenges to come, with the highest COVID cases recorded since January at over 58,000. The UK Health Security Agency saying Omicron will become the dominant variant in a matter of days, not weeks. Michael Gove chairing COBRA from isolation after coming into contact with a positive case, not ruling out even more restrictions.
We absolutely do need to keep everything under review. I think the approach that we're taking is proportionate.
We recognise the importance of balancing people's ability to get on with their lives with the need to protect them against this virus. But action is absolutely required. And as new data comes in, we will consider what action we do require to take in the face of that data.
Earlier in the day, the Scottish Government released this data from one lab showing what it described as exponential growth of Omicron cases. Nicola Sturgeon predicting the start of a new wave.
To be blunt, because of the much greater and faster transmissibility of this new variant, we may be facing, indeed, we may be starting to experience a potential tsunami of infections.
Boris Johnson was spending time with his new daughter today, but warnings from his own backbenchers that next week's vote could see a damaging revolt.
I think a lot of MPs on the Conservative side are urging him to do better and to sort out these immediate problems. And we want him to change policy on COVID because we think these latest steps are going too far. We think it's given too much ground to the scientific and medical advisors and not enough to the economic and social and probably mental health advisors as well.
The measures are likely to pass with Labour's support. Keir Starmer, though, has this message for unhappy Conservatives.
Are they prepared to go through the degrading of themselves and their party, to go out to the media, have to defend the indefensible for months to come, or are they going to actually have the courage now to challenge them and say, you're not fit for office?
Boris Johnson seemingly under pressure like never before on lots of different fronts. Questions about the 2020 Christmas parties, those are still there. The refurbishment of his Downing Street flat, that's popped up again as well. And now some of his own MPs openly defiant on new COVID restrictions too. All of that on top of new Omicron cases as well. Not exactly the Christmas that Boris Johnson would have wanted. As news broke today that this year's Christmas party at number 10 is cancelled, there was a reminder of the anger still felt about last year's rumoured festivities. Bereaved COVID family members arrived outside the Prime Minister's door with wine and cheese in tow. With rising COVID cases,
an entry ban over Omicron. Israel closes its borders to foreigners. Most Israelis have already been vaccinated twice or even 3 times. But initial studies suggest the new virus variant is circumventing some vaccines. That means even vaccinated individuals can become infected. Omicron is causing a dramatic rise in infections in South Africa. BioNTech researchers are already developing a vaccine against the Omicron variant, available in March.
Welcome, I'm Ben Fazulin. South Africa discovered the new variant, but that doesn't mean Omicron originated there. It's more a sign of the country's prowess in gene sequencing. We'll talk about that with virus hunter Emma Hodcroft in a moment. First, this report.
Stranded travelers, plunging stock markets, new lockdowns. Call it the Omicron effect. The variant was first identified by South African researchers. Lab workers running COVID-19 tests started to find cases that didn't match known virus profiles. So they alerted virologists who studied the virus's composition by sequencing its genes. Sequencing is a tool that allows scientists to follow how a virus mutates. That means they analyze genetic material by reading its components, each one like a letter of the alphabet. South Africa has highly advanced sequencing labs, a legacy of the HIV and tuberculosis epidemics, which saw the country develop significant testing capabilities, now directed toward coronavirus research. But there's a downside. Many countries instituted travel bans on South Africa as soon as Omicron was revealed. Some say that the country is now being punished for its transparency and its research. But will such travel bans even work?
When you are kind of taking measure against a country, it is like it is the measure against a good surveillance system. So the fact that other cases are being discovered in Europe is not unexpected, and it may happen in other countries.
Those travel bans are still in place, however, even though the virus is known to have already traveled all over the world.
And now to molecular epidemiologist Emma Hodcroft. Thanks for your time. Tell us more about how sequencing actually works and how you draw real-life conclusions from mutations.
So mutation is really a way of life for viruses. They mutate quite a lot. Importantly, most of these mutations won't impact how the virus works, but they're important clues that we scientists can use, because if we see two viruses that have similar mutations, they're probably more closely related. And when we analyze all of the sequences of SARS-CoV-2 that are available, we can basically make a virus family tree. This lets us trace how the virus has moved around the world, how it's changed over time, and perhaps most importantly, how it's acquired new mutations that could indicate the virus is changing how it works.
So how
a lot happening at Stanford. Medical researchers there are working to unlock key mysteries and how Omicron came to be and why it's spreading so fast around the world. They also may have found a key to slowing it down thanks to lessons from the HIV pandemic. Here's NBC Bay Area's Robert Honda.
Well, here at the Santa Clara County Public Health Department, the health officer says she's intrigued by these findings, and so are other medical experts. The newest COVID-19 variant, Omicron, is the one to watch right now. Scientists have speculated that of all the other unnamed variants, Omicron evolved faster and with more mutations because it likely originated in someone with a compromised immune system, potentially someone with HIV. Stanford researchers, including Dr. Seth Hoffman, agree after finding similar evidence when treating a patient with uncontrolled HIV who contracted COVID several months ago.
She developed those mutations within a short time span, 15 days, where her immune system was not working properly to evade or control the COVID infection.
Dr. Hoffman says the HIV patient is an example of how someone with an already compromised immune system could spread a mutated form of COVID rapidly in public if she had not been isolated. But he says the most significant finding is that the patient responded so well to readily available AIDS treatment, and that allowed her to fight off the virus quickly, meaning battling the HIV pandemic could be key to slowing the COVID pandemic.
That treatment is so effective today all over the world that we can actually stop their infections in the track and reduce the chance for spreading any sort of new variants.
The Stanford discovery was applauded by Dr. Peter Chin Hong of UCSF. He echoed Dr. Hoffman's sentiments that the message here is not to stigmatize HIV patients or anyone with compromised systems, such as those with cancer or awaiting transplants, but to make sure we're doing all we can to get them treatment.
We're not really sure where these variants emerged, but it does make a good case for really being comprehensive in taking care of everyone's health.
Both experts also reiterated the need for getting vaccinated to protect the one getting the shot and hopefully reduce transmission to those with compromised immune systems who develop those prolonged infections. In San Jose, Robert Honda, NBC Bay Area News.
Welcome to the show. 10 days ago, no one had ever heard of Omicron. Tonight, the new COVID variant is very much here in the United States. It's now been detected in at least 16 states across the country. Some early data suggests the Omicron variant might be more contagious than the Delta variant. It's so far reached 38 countries across the globe. Here's the CDC Director, Dr. Rochelle Walensky, with what we know so far.
We know it has many mutations, more mutations than prior variants. And many of those mutations have been associated with more transmissible variants, with evasion of some of our therapeutics, and potentially evasion of some of our immunity. And that's what we're watching really carefully.
Researchers believe it shares genetic code with the common cold, which makes it more transmissible. However, initial data suggests, although it's easier to catch, you might not get as sick. But look, we just don't know for sure. Still, world leaders aren't taking any chances, opting for a grab bag of do-it-yourself measures to try and stop the spread and to save face. Our own president is among them.
We're going to fight this variant with science and speed, not chaos and confusion. Just like we beat back COVID-19 in the spring and more powerful variant, Delta variant, in the summer and fall.
Hold on, Mr. President. Yes, the numbers are down from the summer, but we are still taking a beating from Delta. We were still taking that even before we got to Omicron. In fact, just take a look at the numbers. Hospitalizations and deaths from COVID-19 are now increasing in the US again. The 7-day average nationwide in the last week sitting above 100,000 new cases. And again, that's before Omicron. Yet you have a Republican Party that is working around the clock trying to block every possible safety measure to protect our citizens from COVID, whether it's the Delta or Omicron versions. The GOP, in fact, is effectively pro-COVID, from the federal to the state level and everywhere in between. In Florida, Governor Ron DeSantis is leading the charge, signing anti-vaccine mandate laws. Biden's nationwide vaccination mandates for workers are being held hostage by the courts by Trump-appointed judges. And just this week, GOP senators stalled the passage of the National Defense Authorization Act after introducing an amendment that would prohibit the Defense Department from penalizing unvaccinated National Guard members. And all of this, remember, in the name of the Republican Party's endless fight for freedom and liberty. I mean, the sheer hypocrisy of those words. To be clear, when 3,000 people were killed 20 years ago on 9/11, the Republicans didn't give a damn about freedom and liberty. They cracked down on our liberties, supposedly to save lives. Yet at the height of this pandemic in February, we lost 5,000 lives in a single day. On average right now, we're still losing 3,000 Americans to COVID twice a week. But oh no, this time it's all about freedom and liberty. This time we can't even accept the mildest of safety measures. We're not asking for Americans to be surveilled or detained without trial. We're asking them to wear a mask and get vaccinated. And I, for one, am not going to take lectures about liberty and freedom from the party that implemented the Patriot Act and sent people to Guantanamo Bay. The same people who today think mandating a shot in the arm after 786,000 Americans have been killed by a virus is somehow totalitarian. The great irony is that the measures announced by Joe Biden in recent days to fight COVID, and specifically Omicron, they're not tough enough. They're pretty mild by international standards. And some might say too little too late. In Europe, by contrast, multiple governments have announced tough new measures to tackle the growing wave of winter COVID cases. Austria has reimposed lockdown restrictions, closing restaurants, hotels, bars and museums until at least December the 11th. Germany has said people who aren't vaccinated now cannot enter businesses, restaurants, cinemas. They have basically implemented a complete nationwide lockdown for the unvaccinated, while the UK has announced mandatory testing and isolation for all arrivals to the country. Meanwhile, Joe Biden says the White House is planning on pressuring insurance companies to reimburse Americans for rapid at-home tests. Rapid tests which have been readily available for free for many months now in a bunch of European countries, including the UK. One expert embarrassingly calling the US a, quote, international outlier when it comes to rapid tests. I just don't get it. We are more than a year and a half and more than 750,000 deaths into this pandemic here in the United States. And we're still not taking it seriously enough. Still not doing what needs to be done. Still coddling the COVID conspiracists and the anti-vaxxers. We should be escalating, not de-escalating vaccine mandates. I mean, why on earth do we still not have a federal vaccine mandate for all domestic flights? Why? Here's what the director of the National Institutes of Health, Dr. Francis Collins, had to say when asked about it on Meet the Press this morning.
If you tried to impose those kinds of restrictions on domestic air travel, that would be extremely onerous for people who are trying to get around the country for things like holidays. And I don't know how much we'd gain by it.
Onerous? Who cares if it's onerous? Are we really saying that trying to protect the lives of the thousands of Americans who will die from this virus in the coming weeks and months is less important than inconveniencing people at airports by asking them to show a vaccine card before they board their domestic flight? God forbid adding an extra few minutes to people's Christmas travel time in the midst of a global pandemic. And remember, it is a global pandemic. What we do here affects everyone else around the world, and vice versa. In a global pandemic, no one is safe until everyone is safe.